Under the light of a full moon on a quiet night, two guards stand alert, holding their long spears. While in the prison, a doctor was left in a pitiful state from his severe injuries. In the king's presence, the doctor had proposed a bold treatment for his illness, explaining that his recovery would require cauterization and a small incision in the skull to expel what he called wind syndrome. The king, Cao Cao Wei, appears and furiously points an accusing finger at him, telling him that he knows of his kinship with Guan Yu, and accusing him of trying to use this opportunity to kill him and avenge Guan Yu. The king orders his guards to seize the doctor and throw him into the dungeon immediately, and despite his attempts to object, he steps forward to defend himself. He warns the king that if he is imprisoned, no other doctor will be left who can treat his majesty or even the prince's illness. King Cao Cao's anger intensifies, and he asks disdainfully if he is implying that his life and his son's life depend on his hands, calling him nothing but an arrogant physician. Then, he yells at his guards, ordering them to inflict the cruelest imaginable punishment on him so that he would never dare to open his mouth again. As he is led away, the doctor feels the bitterness of the injustice that has befallen him, as all he ever wanted was to save more lives. He recalls the moment he handed his medical books to a jailer, hoping that these texts would continue to help doctors heal the sick throughout the country. He thinks that this is enough, even if he dies. It is sufficient for him that others continue to save lives. Suddenly, in a completely different place, he awakens in a modern room, clutching his head in pain, wondering in confusion where he is, and how long he will remain trapped like this. He thinks that if he is still alive, he must save more patients. His hand falls on a book, and he wonders why a medical book is in this place, which reminds him of his student days and the passion he felt when reading medical texts for the first time, how he never wanted to let them go, believing that he wouldn't have become a doctor without them. The young man is astonished by the book's precise content, which surpasses any medical book he has ever seen. What's even stranger is that he understands every word in it, even though the characters look completely new to him, and then he reads the title aloud, Basic Human Anatomy. At that moment, strange memories that are not his own flood his mind. Vivid memories of another person in a modern medical setting, feeling as if he had lived them himself. He clutches his head from the intense pain and confusion, then looks at his reflection in the mirror in shock, wondering what is happening to him, and if it's possible that he has possessed this young man's body. He shouts, calling out for anyone to explain what is going on. After calming down a bit, his eyes begin to explore his surroundings, and he recognizes a refrigerator and its function of preserving food, his astonishment growing as he wonders how this is possible and what era he is in now. The doctor realizes that these memories flooding his mind must belong to the young man whose body he has possessed. He takes a few steps back in shock, leaning against the refrigerator while still dazed, and wonders how far into the future he has traveled. A strange machine in the room catches his attention, and his new memories tell him it's called a computer. He finds his body moving on its own as if it remembers how to use it. His hands reach out and type a username and password unconsciously, which astonishes him even more. He discovers that in this era, doctors can use this device to search for surgical data from other doctors' operations, expressing his immense admiration for this amazing world, believing that in such a time, anyone could become a doctor. His amazement continues when he learns that modern medicine is not limited to reattaching severed blood vessels but can also reconnect nerves, leading him to conclude that modern medicine is truly incredible. Amidst this fascination, he begins to wonder why he was sent to this era, believing there must be a hidden reason behind it. Suddenly, his thoughts are interrupted by a violent knock on the door, and someone shouts, calling for Lee Min-ho and ordering him to open the door, calling him a skinny punk. His heart reacts instinctively to the situation, and he realizes that the person behind the door must be someone Lee Min-ho feared greatly. The door is forced open as the intruder yells, asking if he realizes the mess he has caused, and approaches him angrily to ask if he has lost his mind. This confrontation triggers another memory of Lee Min-ho being berated by his colleagues, who blamed him for getting them scolded as well, asking if he felt any remorse, and wishing he could handle things properly just once. He knew from his memories that the intruder was Kim Hyung-seon, Lee Min-ho's fellow intern. Hyung-seon grabs his clothes violently, scolding him for ignoring an important call as an intern, adding that because of him, he also got reprimanded by someone named Choi Young-soo. The doctor calmly asks him to let go, but Hyung-seon scoffs at his defiant tone and refuses, so the doctor decides he cannot allow himself to be overpowered in this situation, and with a swift, sudden move, he flips him and throws him to the ground. Outside, near a taxi, Hyung-seon gets up, holding his jaw in pain, and asks Lee Min-ho where he learned to fight like that. The doctor apologizes formally, explaining that his body acted on its own due to the recent hardships he has faced. Hyung-seon is puzzled by his strange way of speaking, and the doctor wonders to himself if his manner of speech seems odd in this era. His colleague continues to berate him, insisting that finishing a shift is no excuse to ignore a call, and warning him of the dire consequences during the intern evaluations later. but the doctor wasn't listening. He was mesmerized by the beautiful city view from the car window, watching the cars, skyscrapers, and the massive bridge, amazed by how advanced this world was. He remembers his past days, where reaching a critical patient quickly on horseback was considered a stroke of luck. He sighs wistfully, wondering, if he had lived in a place like this, how many more lives could he have saved? When they arrive at a huge modern hospital building, Hyung-seon tells him to be ready to apologize as soon as they go inside, while the doctor is still marveling at the comfortable transportation he had never seen before. Kim Hyung-seon notices the doctor trembling and asks worriedly if he's okay. The doctor clutches his chest in pain, realizing in that moment that the body's true owner, Lee Min-ho, is speaking to him from the depths of his consciousness, telling him clearly that he had died the previous night, and that this hospital they are heading to is what killed him. A series of overlapping memories flash through his mind, where he sees a medical team trying to resuscitate a patient with ventricular fibrillation, ordering the defibrillator to be charged to 150 joules. The memory becomes clearer, and he sees Lee Min-ho himself, standing and watching the scene in shock and horror. The memory shifts to the office of the department head, Hwang In-bong, who was yelling furiously that even an intern should know not to bring a deceased patient into the operating room. Hyung-seon tries to defend the situation, explaining that the case was urgent, but the department head cuts him off angrily. Hwang continues his yelling, revealing that the patient's family has filed a lawsuit and the emergency department claims the patient was still alive, leaving him to face this mess because of a negligent intern who didn't check the patient properly. After Hyung-seon looks frustrated, the department head asserts that this issue will not be overlooked, then issues an order to keep Lee Min-ho on continuous work shifts until the lawsuit is dropped. Another memory appears of Min-ho returning exhausted to his room and collapsing on his bed, remembering his last thoughts before he died from overwork at the age of 27. As he and Hyung-seon enter the hospital, the doctor thinks that people in power, both in the past and the present, only care about their pride. As soon as he enters, he is stunned by the sheer number of patients waiting in the lobby. But instead of feeling overwhelmed, his eyes sparkle with excitement, happily wondering if he will get to examine all these patients himself. They are interrupted by another doctor, Choi Young-soo, a second-year resident, who confronts them angrily, calling them insignificant, and asking why they were late, directing his threat specifically at Lee Min-ho. The doctor remembers from Min-ho's memories that Young-soo is known for his bad temper. Young-soo scolds him for not responding, then throws him the file of a car accident patient. He orders him to intubate the patient while he secures a central venous line, noting that the patient's vital signs are a mess, and concludes with a harsh warning that if he fails like last time, the patient will really die this time. While Hyung-seon looks at him with concern, the doctor views the situation with determination, assuring himself that he can do this. The doctor feels that all the medical procedures Lee Min-ho had learned have been imprinted on his mind as if they were his own knowledge. He focuses on the intubation task before him, a life-saving technique used when the airway is blocked or when chest injuries impede breathing. Using Min-ho's memories, he begins the procedure, first inserting a laryngoscope into the patient's mouth, ensuring the glottis is clearly visible, then gently advancing the tube past the glottis, and securing it in place. The doctor announces that the tube has been successfully secured, and the resident, Choi Young-soo, orders him to proceed while looking at him in astonishment. Young-soo thinks to himself that he was ready to scold him harshly if he had fumbled, but he believes Min-ho was lucky this time. Next, they move on to examine the X-ray image, and the doctor is deeply impressed by this technology that allows one to see inside the body. He notices fractures in several ribs and wonders if the condition is flail chest, and he also sees shadows indicating a sternum fracture as well. At that moment, another doctor named Oh Guk-han, a fellow in the cardiothoracic surgery department, arrives. Young-soo informs him that the image shows an anterior flail chest with a sternal fracture, to which Guk-han adds that with this level of injury, a myocardial contusion and sepsis are likely, and he orders an ECG and an ultrasound. He announces that once the tests are done, they will need to open the patient's chest and asks Kim Hyung-seon to call the anesthesiologist and book an operating room. Hyung-seon rushes off, while Guk-han notes that he will likely be the one performing this surgery. Guk-han turns to the doctor who had been standing silently, and tells Young-soo that he will take Min-ho and another intern with him, while Young-soo handles other matters. Young-soo objects, reminding him that Min-ho is barred from his duties as a disciplinary measure, but Guk-han dismisses it, saying he'd rather keep him close to watch him. He then turns to him and tells him to stay focused this time. The doctor enthusiastically replies, "Yes, sir," feeling overjoyed that he will finally witness the surgeries he has only seen in videos. Inside the operating room, he observes the patient's open chest, noting the torn lung and the blood pooled around the heart. Guk-han begins the surgery, explaining that the first step is to control the bleeding and drain the fluids. He orders the bleeding to be stopped before connecting the drainage tube and asks for a needle, to which the doctor replies that he understands. The doctor watches Gukhan's precise skills with admiration, thinking to himself that he thought he would never stand before a patient again, and wonders if he will get a chance to perform a surgery himself as long as this possession continues. He realizes that as an intern, he might not get that chance, but he wishes he could stay longer, to save more patients, not in the harsh conditions he previously lived in, but in this modern era where everything is prepared and available. After the surgery concludes successfully, Gukhan goes to reassure the patient's relative that the operation went well, and she thanks him warmly. Later, Gukhan tests the doctor's knowledge, asking him about other risks of myocardial contusion. He answers confidently that the patient could suffer from ventricular arrhythmia or heart failure. Gukhan continues his test by asking about the appropriate medications, to which he replies that cases are treated with antiarrhythmics like lidocaine or digitalis in cases of heart failure. Gukhan is impressed by his answer and reflects on Minho's situation. He had heard that the residents were giving him a hard time on the department head's orders, but he notices that the young man seems to have overcome all those difficulties. While most people would have given up, Minho's gaze appeared more vibrant and determined, reflecting his exceptional passion for his work. Later, the other intern, Sung Ji-oh, offers him a cup of coffee, commenting that he thought he was a troublemaker but has changed his mind, and Gukhan agrees. He asks him to stop bothering Minho and treat him kindly, especially since the lawsuit has been dropped, and explains that he should look after him secretly and carefully, to which Ji-oh agrees. After Gukhan leaves, Ji-oh remains worried, for although he realizes Minho was unfairly blamed, he wonders if the department head, Huang, will truly remain silent. In the break room, the doctor sits down to eat his first meal of the day, wanting to eat quickly before any emergency. He contemplates a bowl of instant ramen, admiring its fragrant smell and the strange shape of its noodles. As he prepares to taste this modern food, Choi Young-soo suddenly appears and asks if he is eating. The doctor replies that he just got some free time, but before he can take his first bite, Young-soo snatches the cup from his hand, declaring that he is starving and ordering him to make another one for himself. The doctor thinks to himself that he has never seen a more despicable scoundrel than Chow Chow, and that this man deserves a beating. Meanwhile, Ji-oh watches the situation and talks to Young-soo about his constant complaints about Minho, who ignored his call and left his shift. But Ji-oh defends him, saying it was outside his official work hours, and that Dr. Gukhan had told them to stop bothering him, which surprises Young-soo. The two residents continue their conversation, with Sung Ji-oh expressing concern that interns are avoiding their department, and if the harassment continues, they might not find enough applicants. Young-soo replies indifferently that it happens anyway, so it's better to work them to the bone so they learn. Ji-oh points out that they haven't really taught Minho much of anything, but have only harassed him. Young-soo gets angry and accuses him of defending him, sarcastically asking if he bought him a meal, making Ji-oh think to himself how childish his colleague is. Later, the doctor goes on rounds with Sung Ji-oh, where interns learn basic clinical skills. The doctor notices that unlike with others, his heart doesn't pound anxiously next to Ji-oh, which leads him to conclude that he is not a bad person. Ji-oh asks him about his next rotation, and he replies that it's the emergency medicine department. Ji-oh comments that it might be better than their department, and the doctor wonders to himself if Ji-oh realizes the extent of the injustice Lee Min-ho had suffered. Ji-oh continues talking about the time for choosing a specialty, and the doctor replies with a smile that he is considering cardiothoracic surgery or neurosurgery. Ji-oh is shocked by his answer, wondering why he would want to join their department, after all he has been through. Out of curiosity, he asks him to follow him to test his skills, and asks him about the most important precaution when performing an incision and drainage of an abscess. The doctor answers confidently that the most important thing is to control the depth of the local anesthetic injection. Ji-oh is impressed by his knowledge and allows him to perform the procedure. The doctor performs the procedure skillfully, incising and draining the abscess, remembering how in his time they would just puncture the skin to squeeze it. He thinks about how times have changed and abscesses are now removed in such a clean way, ensuring faster healing. Ji-oh watches him in amazement, noticing that his finishing touches are even cleaner than his own, and remembers that Minho was completely helpless in a similar case just days ago. He is deeply surprised by how his skills could have improved so dramatically. After the doctor finishes the procedure, Ji-oh's suspicion grows. He finds it impossible for someone to improve so quickly. As he recalls Minho's previous confusion, a strange idea begins to form in his mind as he wonders, could this person be? After the doctor successfully completed the procedure, Sung Ji-oh continued to think doubtfully, finding it impossible for someone's skills to improve so quickly. He wondered in confusion, could this young man be? Then tried to find a logical explanation, speculating that Minho might have been discouraged all this time and unable to show his true abilities. Ji-oh came to a new conviction. With such a skill level, the young man would be very useful to the department, and he decided to treat him kindly from now on and persuade him to join them. Later, Ji-oh bought the doctor a large meal, and despite being worried about the cost, He assured him it wasn't a problem. The doctor looked at the food with wonder, especially the triangle gimbap, and commented on its strange shape, which puzzled his colleague. The doctor tasted the food and expressed his immense admiration for its harmonious flavor, then mixed it with the ramen, describing the combination as the perfect formula. He was amazed at how one could eat such delicious food so cheaply and at any time in the modern era, to the point that he considered it the best thing about modern times. Gio watched his odd reactions and became certain that Minho was indeed an eccentric. Back at the hospital, while the doctor was entering medical orders into the computer system, he noticed that it felt familiar, as if he had always done it. He realized that if his practical experience from his past life merged with the medical knowledge in Lee Minho's body, it would create a great synergy. But a new thought occurred to him, and he wondered why this possession hadn't ended yet. He began to consider the possibility that what was happening to him might not be a temporary possession, which meant he might be able to stay here and continue his life as a doctor, a thought that filled him with hope. After that, he headed to the training room, feeling that his current situation was like that of soldiers in barracks, constantly training to hone their skills. Meanwhile, Choi Young-soo approached him and asked if he had given the orders to the nurses correctly, and he answered in the affirmative. Young-soo told him he heard he was considering specializing in surgery, which caught the attention of the other interns, and he tried to persuade him to join their department, promising to put in a good word for him with the other departments. The doctor smiled cynically to himself and decided to tease him a bit, telling him he would look into other departments but would consider cardiothoracic surgery his first choice unless something exceptional came up. Though the other interns thought he would surely pick a different department, Young-soo was delighted by this response and called over the other interns to ask about their future specializations in an attempt to embarrass them, but they didn't answer. He sighed in frustration and told them to get back to what they were doing, ordering the doctor to sit down as well. Choi Young-soo told the doctor he now wanted to test his surgical suturing skills, and handed him a specialized training pad. The doctor noted its texture was just like real skin, and thought that practicing on it would develop skills much faster than on cloth. He began suturing the pad with incredible speed and skill, and quickly finished the task, astonishing Young-soo and the rest of the interns. Young-soo grabbed the pad, unable to believe his eyes, and asked if he had really finished all of it, to which he calmly replied, yes. Young-soo examined the stitches in amazement. The spacing and depth were perfectly uniform. The other interns expressed their deep admiration, with one even whispering that his skill surpassed his own. Kim Hyung-seon jokingly asked when he had practiced all this, and he replied that you could say he had practiced an unbelievable amount for a very long time. Young-soo wasn't satisfied with that and presented him with a new challenge, a training kit for vascular anastomosis, and he asked him to try it, which the doctor agreed to despite his colleague's surprise. Young-soo told him to start with the anastomosis of the aorta. The doctor examined the artificial artery, then began suturing it with precision. Young-soo stood dumbfounded, wondering how an intern could be so proficient, especially without even using a magnifying loupe. Gio noticed the doctor was working smoothly without making any mistakes, and in moments, he finished suturing the artery with excellent precision, which confirmed for him that Lee Min-ho was the talent his department needed. That night, Kim Hyung-seon and some other interns were walking outside the hospital, feeling that Min-ho had made them look like fools. They dismissed his desire to join their department and wondered about the source of his sudden skills after being the worst among them, also noting that his way of speaking had changed. Kim Hyung-seon remembered that when he went to pick him up that morning, after being thrown to the ground, he saw him watching a video of a heart transplant surgery. They concluded that he was studying hard at home, and one of them commented that he was fighting hard to survive. Hyung-seon expressed his frustration. He had thought he was simple and naive, but he had surprised them. So another suggested that what he was doing was actually amazing. Their colleague An Ji-soo joined them, commenting that she had never seen him like this before, and that his passion for medicine was surprisingly immense. An Ji-soo continued her talk, asserting that the suturing skills he demonstrated couldn't be acquired in a day or two, and concluded that it would be good for him to choose the surgical field, adding that his outstanding performance had motivated her to work harder. Meanwhile, the doctor was eating and felt his ears itching, a sign that someone was talking about him. Later, in the operating room, he participated in a surgery for a patient with a Morgani hernia. Under the supervision of Dr. Oh Guk-han, all that was left was to close the wound. Guk-han called for Lee Min-ho, telling him he had heard about his suturing skills and his intention to join their department, then gave him the chance to prove himself and asked him to close the patient's wound. The doctor felt overjoyed and answered with complete confidence that he could do it. Before starting, he made sure everything inside the wound was fine, then announced he would begin by connecting the drainage tube and suturing, and requested the necessary tools. The doctor carefully placed the drainage tube, then began suturing the muscle layers with extreme precision, which impressed the observing Guk-han. Guk-han remembered Gio's words that if Min-ho were trained well, he would become an exceptional doctor, and now he understood his colleague's high praise. After finishing, he informed Guk-han that the wound closure was complete. Gukhan inspected the neat stitches with admiration, then turned to him and gave him the highest praise, telling him he was the best intern he had ever seen. Later, in the Ward 16 break room, Professor Kim Joo-hyuk was reviewing patient files. He noticed that the suturing skills on the wounds couldn't possibly be a resident's and discovered that all of Gukhan's patients had the same type of neat stitches. He summoned a resident and asked if Gukhan had performed the surgery, which the resident confirmed, denying any error in his orders. The professor concluded that Gukhan must have closed the wounds himself but found it strange. The resident revealed the truth, surprising the professor by saying that Gukhan hadn't done the suturing. The professor asked in shock, "Then, did you do it?" Component placement, and the resident replied that the one who did it was the intern, Lee Min-ho. Professor Kim Joo-hyuk couldn't believe what he was told, but Sung Ji-oh confirmed that the intern Lee Min-ho was the one who performed that masterful suturing, enthusiastically telling him that he was a rising star in the cardiothoracic surgery department. News of the young man's skill spread quickly through Seoul University Hospital. The next morning, doctors were talking about him in the cafeteria, with one speculating that he must have pulled himself together during his punishment period and that his suturing skills now rivaled those of specialists. Another doctor added that Sung Ji-oh was going around the hospital trying to convince everyone that they had to recruit Min-ho to their department. A skeptic wondered if he would agree to join them after all the difficulties he had faced. But his colleague replied that he heard Min-ho himself had stated he would apply to their department unless something exceptional came up, which surprised them. The conversation then shifted to ask which department he had moved to, and the answer was the Emergency Medicine Center. Indeed, the doctor had started his shift in the emergency department with his colleague An Ji-soo, who explained to him that emergency medicine is different from surgery, as the priority is first aid and accurate diagnosis. The doctor felt a bit regretful that he wouldn't be able to enter the operating room, but he was looking forward to examining a diverse range of patients. Upon entering the department, they were greeted by their colleagues, Hee-woong and Seok-gun. After exchanging greetings, he joined them, and the doctor realized these were his colleagues from the orthopedic surgery department. Seok-gun approached him warmly, expressing his sorrow for the hardships he had faced, and encouraged him to start a new chapter, which made him feel that this colleague wasn't a bad person. Ji-soo asked about the strictest doctor in the department, and Hee-woong replied that Dr. Woo In-hai could be scary but wasn't bad, and that the person they really needed to watch out for was someone else. He revealed it was Professor Jang Tai-ju. Ji-soo was surprised it was a professor, and Hee-woong explained that he was the professor personally recruited by the hospital's chairman to establish the trauma center. He added that although he's a good person, whenever a serious trauma case arrives, he grabs any nearby resident and heads straight for the operating room, putting the ER doctors in a difficult position. And no one dares to challenge him because he's backed by the chairman. The doctor eagerly asked if the professor also takes interns with him, and Hee-woong said yes, but their role is limited to preparing for surgery. The doctor's eyes lit up, realizing this could be a new opportunity for him. Meanwhile, elsewhere, the fellow, Shin Hee-cheol, was talking about the intern Lee Min-ho, remembering that he was the one punished by Professor Huang with endless shifts after that patient's death. The fellow, Shin Hee-cheol, continues his conversation with the resident Cha Sang-sik, who asserts that Lee Min-ho's arrival in the ER has made things a bit awkward for everyone. But Hee-cheol disagrees, saying the problem from the start was the ridiculous lawsuit filed by the patient's family, that no one should have been held responsible, and that Professor Huang was too harsh in his reaction. He added that he heard Huang had taken leave and gone abroad after the lawsuit was dropped, which makes him seem like a petty man in his eyes. Sang-sik expressed his concern, pointing out that Lee Min-ho was known for being clumsy and unreliable even before the incident. Suddenly, Hee-cheol heard a doctor yelling sharply at a resident, reprimanding him for not being able to perform his duties properly. Hee-cheol recalled scenes from the past, where Min-ho was constantly scolded and sometimes hit by Choi Young-soo for not following basic protocols, and he saw him as a defeated doctor. After these memories, Hee-cheol agreed that Min-ho was indeed unreliable. However, he added that he heard from Dr. Oh Gukhan that the young man had recently come to his senses, and he decided to test him himself. He asked Sang-sik to tell him to be on his toes, because if his performance was worse than before, he would never tolerate it, as he wasn't the type to let things slide. Later, Hee-cheol gathered the new interns and described the ER as a real battlefield, where they must master basic clinical skills. He then addressed the doctor directly, noting he had heard of his intention to choose cardiothoracic surgery. He told him that the general surgery department might consider him a promising intern, but warned him not to slack off in the ER. The doctor replied calmly, assuring him he would learn diligently as he understood the department's importance in treating critical cases. Hee-cheol was impressed by his answer and, with a sly smile, asked if he had reviewed the medical records. The doctor answered with a confident yes, which shocked his colleagues. He remembered the vast amount of records he had gone over, but thanks to his past experience, the information wasn't difficult for him to understand. Hee-cheol was surprised by his response, and wondered if he had truly changed. The doctor then turned the tables and asked his two colleagues if they had also reviewed the records, and they stammered and hesitantly said yes. Hee Cheol smiled, commenting on their enthusiasm. And since the department was quiet, he suggested a small quiz, which terrified the other interns. Shin Hee Cheol began his test, presenting them with the case of Mr. Shim Ji Hwan, a 72-year-old, and asked for details. The doctor answered immediately, explaining he was found unconscious on the street. Hee Cheol continued with questions about the patient's condition upon arrival, and the doctor recited the medical details with stunning accuracy, including the Glasgow Coma Scale, vital signs, and pupil size, adding that he smelled of alcohol and his medical history was unknown. Hee Cheol was impressed by his answer, then tested Byun Hee Wong, asking about the tests performed. The latter hesitantly replied that they must have started with a head CT scan. Hee Cheol immediately scolded him, pointing out that there were procedures to be done before that. When his colleagues couldn't answer, he asked the doctor to continue, who explained that preliminary tests were necessary due to his altered consciousness. Hee Cheol agreed, adding that blood gas analysis showed no issues but his sodium level was low. The doctor completed the analysis, explaining that a head CT was performed afterward, and the results showed a subarachnoid hemorrhage. Hee Cheol tried to trap him by asking if they had immediately notified neurosurgery, and the doctor said yes, but added that it was done after confirming there were no signs of sepsis. Hee Cheol was shocked by the precision of his answer. He had expected a simple reply, but the doctor showed a deep understanding that went beyond mere memorization, while the others were amazed at his ability to remember. The quiz was interrupted by a man rushing into the department, carrying a crying child on his back, begging them to treat his son. Hee Cheol ordered the child to be placed on a bed, and the medical team began cleaning his deep, bleeding wound. They tore his pants to reveal the wound was above the knee, and Jisoo began cleaning it with antiseptic. Then they dried it to accurately assess the damage. The doctor noticed the bright red blood indicated an arterial injury, and from the wound's depth, he deduced the descending genicular artery was injured. Immediately, he applied firm pressure to a specific point on the child's thigh to stop the bleeding. Hee Cheol looked at him in shock and asked how he managed to locate the artery with such precision, and he calmly replied that he had visualized the surrounding anatomical structures and then located the blood vessel. After the doctor masterfully stopped the child's bleeding, a nurse handed the local anesthetic to the fellow, Shin Hee Cheol, who was still watching the situation in amazement, wondering to himself if this young man, Lee Min-ho, was a genius. Later that night at Seoul University Hospital, the doctor enjoyed a late but delicious dinner in the cafeteria and decided he would visit more often. While thinking about the next day's menu, he saw the resident, Woo In-hai, severely scolding his colleague, An Ji-soo. In-hae was sharply asking her if she was an intern or a resident, and the doctor was not pleased with the scene before him. In-hae added that if Jisoo was going to give orders herself, she might as well be the resident. She continued to reprimand her, saying she should at least issue the correct orders, reminding her that for a female patient complaining of abdominal pain, the possibility of an ectopic pregnancy must always be considered. Jisoo tried to defend herself, explaining that the patient had mentioned her period came a few days ago. The doctor thought to himself that Jisoo had made a mistake, which was unfortunate, but everyone sometimes learns through scolding, and that to get to the resident's room, he had to pass this way. But In-hae cut her off angrily, asking who told her that having a period rules out the possibility of pregnancy. The doctor tried to pass by quietly, but she stopped him. So he cleverly changed the subject and asked if she had eaten dinner, enthusiastically recommending a delicious soup dish. In-hae replied coldly that when she was an intern, she didn't have time to go to the cafeteria, commenting that interns these days are spoiled. Then she turned to Jisoo and warned her that she would overlook her mistake this time, but she wouldn't forgive her if it happened again. After she left, Jisoo thanked the doctor for his help, and he replied awkwardly that he hadn't really intended to help. Late at night, the ER interns were taking turns on the night shift after a long day of work. The doctor noticed the extreme exhaustion on his colleagues, but unlike them, he was enjoying being able to see patients non-stop, remembering how he used to stay up for days on end in his past life, caring for plague patients. Meanwhile, the resident Yu Bok-seon was questioning the grandson of a female patient who had collapsed at home. The grandson explained that his grandmother said she was going to the bathroom, then he suddenly heard a loud thud and found her lying on the floor. He estimated she was unconscious for about a minute, and had regained consciousness while being transported to the hospital, but he expressed concern given her age. The resident decided to take a quick look at her and began his examination. After the initial examination, the resident reassures the old woman's grandson that everything seems normal for now. He asks if his grandmother has any chronic illnesses, and he replies that she has high blood pressure and diabetes. He then turns to the woman herself, asking what she felt right before she lost consciousness. The woman describes a feeling of sudden dizziness, as if the blood was draining from her body, adding that she feels some discomfort, but it's bearable. The resident confirms there were no convulsions, ruling out the possibility of a seizure, The doctor was observing the situation, with the standard procedures for such cases running through his mind, which usually start with comprehensive tests before moving on to a head CT scan. But, drawing on his past experience, he realizes the case is most likely just a syncope caused by a temporary decrease in blood flow to the brain, and that her high blood pressure medication is the likely cause, wondering about the necessity of spending money on all these tests. But he reminds himself that he is just an intern and cannot object to the protocol. The resident decides to start with an electrocardiogram, ECG, during the examination. The resident asks him what he sees in the results, and he answers confidently that the ventricular wall looks normal. The resident is impressed with his answer, noting that most interns don't even know what they're looking at. After checking the chest and abdomen and confirming there was no bleeding, he decides to proceed with the head CT scan. After the test results came back, it was clear there was nothing serious. The resident explains to the family that the grandmother's blood pressure medication might have caused the fainting, and suggests admitting her to the hospital for a day for observation, which the family immediately agrees to. Earlier, while talking with his colleagues, the question of who would become the next chief resident came up. Someone mentioned that Dr. Yu Bok-seon was the leading candidate, and the doctor now understood why the professors were watching her so closely. Suddenly, the quiet of the department is broken by the screams of an angry man, protesting that they were running tests on him instead of giving him painkillers first, calling the doctors crazy and starting to shout for the hospital director. Seok-gun tries to calm the patient down, but the man punches him hard, knocking him to the ground, and yells that he's in severe pain, then advances threateningly toward An Ji-soo. Faced with the violent patient's threat to his colleague, the doctor didn't hesitate for a moment. Involuntarily, his fist flew out, knocking the patient to the ground with a single punch, leaving his colleagues in shock. The doctor was furious at how the patient had treated the medical staff, and began to recall this was the second time he had attacked someone as a defensive reaction. He thinks to himself that he has seen many men like this in the chaotic times he lived through. The patient got up angrily, shouting death threats, and lunged at the doctor, who saw that his kind were like beasts who only understood the language of brute force. But the doctor, believing the only way to deal with them is to respond in kind, kicked him hard, sending him crashing into a wall. At that moment, security guards arrived and subdued the patient, who was still screaming and resisting. After the situation was over, the doctor checked on his colleagues to make sure they were okay, and felt relieved when he confirmed they were unharmed. Later, after his shift ended, Seok-gun felt relieved that in the ER, he could at least finish his work on time, unlike in the surgery department where, as Jisoo explained, he would be woken up at any hour. The doctor suggested they go to a nearby restaurant. There, he tried soju for the first time, noting it was clear and didn't smell bad, and he liked its taste more than he expected. Then he tasted grilled pork belly, and was amazed by its delicious flavor, considering it better than any lavish feast he had attended in the past. While they were eating, his colleagues started complaining about the difficulty of night shifts and the abundance of troublesome patients. Jisoo agreed, expressing her frustration with people who call ambulances for minor issues. But Seok-gun said that he felt much better thanks to Min-ho's intervention earlier, and praised his courage in confronting the patient. Jisoo supported him, expressing her admiration for his unexpected strength. It crossed his mind that what he had received from his master was not limited to medicine alone, and he felt reassured knowing his old combat skills were still present. The doctor calmly explained his position, saying he couldn't allow anyone to threaten doctors and cause chaos in a hospital full of critical cases, as he feared the harm it might cause other patients. Seok-gun agrees with his colleague, adding that Min-ho looked ready to use medical instruments as weapons to defend them. He also expresses his amazement at his ability to memorize all the medical records by heart, to which the doctor humbly replies that it's just from reviewing them often. Seok-gun admits he felt a little jealous, and that Min-ho's outstanding performance has motivated him to work harder to catch up. As they talk, a dish of cold noodles is served. The doctor tries it with the pork and is blown away by its wonderful taste, deciding he will definitely visit this restaurant every time he finishes work. After returning to his apartment, he feels extremely dizzy even though he didn't drink much, and feels a strange sensation in his stomach and numbness in his limbs. He decides to sleep it off, but suddenly his body starts shaking violently, his heart races, and then he collapses to the floor, unconscious and vomiting. The doctor doesn't understand what's suddenly happening to him, and a terrifying thought strikes him. Is the possession starting to wear off? He fears that if his soul leaves now, Lee Min-ho's body will be found as a corpse. He anxiously wonders about his soul's fate. Will it return to the past, or will it move to another body again? He feels a strong desire not to go back yet, but his eyes begin to close against his will. The next morning, the doctor wakes up surprised to find the possession hasn't ended. He finds it strange, as last night's symptoms suggested it was about to end. He concludes that Lee Min-ho's body is fundamentally weak, which explains its strong reaction. He feels relieved that the possession is not over and realizes that a week has already passed since he started living in this body, feeling that he can stay here and continue treating patients. But first of all, he decides he must clean up the mess he made on the floor. Elsewhere in the hospital, specifically in the director's office. There was a knock on the door. The director granted permission to enter, and Professor Jiang Taiju walked in. The director asks him how long he has been at the hospital, and he replies that it's been 3 months, to which the director says he must have settled in by now. He then moves on to the main topic, reminding him that the Ministry of Health will be reviewing hospital applications for Level 1 Trauma Center designation, and reveals that their hospital has been shortlisted along with 5 others. The hospital director continues his conversation with Professor Jiang Taiju, asking if the preparations for establishing the trauma center are going well. The professor replies that he tried to persuade a few outstanding residents to switch to trauma surgery, but they weren't enthusiastic about the idea. The director points out that without residents, the ministry will not grant them the necessary approval. The professor suggests they have no choice but to offer better conditions to attract them, but the director objects that this might provoke a backlash from other departments. However, the professor downplays this, explaining that even the department heads know that trauma surgery is an arduous path, so they won't strongly oppose it. The director reluctantly agrees, saying he will need to think it over more. The professor urges him to make a quick decision so he can move more forcefully, reminding him that the ministry's reviewers will scrutinize the surgical records, so they must start building a solid track record of successful operations from now on. The director thanks him and promises he will try to meet with the chairman the same day. Before leaving, the professor asks the director about his strong insistence on establishing a trauma center, even though it's not profitable. The director smiles and explains that if Seoul University Hospital prides itself on being the best in the country, it cannot be without a trauma center, comparing it to a luxury department store that doesn't just sell luxury goods. After he leaves, the professor thinks to himself that it's ultimately about appearances, but adds that if it helps save even one more patient's life, then it's a good thing. In the lobby, the professor meets the fellow, Shin Hee-cheol, who asks if there's any good news from the director. The professor tells him that once the center opens, many positions will be available, and he urges him as a colleague to start thinking about securing a permanent position. Hee-cheol gets excited about the idea, and promises to work hard to achieve it. The professor also asks him to look for promising doctors to join the team. Hee-cheol immediately remembers that there is an intern in the cardiothoracic surgery department with good skills who is now in the ER. Meanwhile, the doctor was reassuring the mother of a small child that his treatment went well. As he was walking through the ER, he spotted Professor Jiang Taiju and Shin Hee-cheol approaching and recognized the professor from his ID card. The doctor steps forward and greets them. The professor tells him he heard he has good surgical skills, to which he humbly replies that Professor Oh Guk-han had trusted him to close a wound in one of the surgeries. The professor shows his surprise that an intern was allowed to perform the closure, a procedure usually entrusted to residents. The professor concludes that if this intern doesn't have strong backing, his skill must be exceptional. He then asks the doctor a direct and tempting question: "Wouldn't you like to hold a scalpel sooner?" The doctor's eyes widen and his heart pounds, realizing this might be his chance, and he answers with great enthusiasm, "Yes, sir." In the ER, a new patient arrives with a nurse. Professor Jiang Taiju asks the doctor, Lee Min-ho, to follow him, announcing that he will see for himself if he is skilled enough. When they arrive, the professor asked about the case, as the patient was in severe pain from her abdomen. The professor looked at Min-ho and then asked him to examine her. Shin Hee-cheol is shocked by this decision and tries to object, reminding the professor that he is still just an intern. But the professor dismisses his objection, saying that they are there to supervise and that after 10 months an intern should know how to handle a case of abdominal pain. He then encourages the doctor to proceed, and he agrees with confidence. The doctor begins examining the patient, who tells him the pain started on the left side of her abdomen and has gotten worse. He asks the nurse for her vital signs, then informs the patient he will press on her abdomen, and asks her to bear the pain as much as possible. During the examination, the doctor deduces from the severity of the pain and the patient's reaction that it's not appendicitis or a stomach perforation, and he also rules out pregnancy or ureteral stones. Based on his experience, he reaches a near-certain diagnosis: ovarian torsion, as the patient screamed in pain. The doctor states his opinion clearly, suggesting they confirm the diagnosis with a transvaginal ultrasound and then transfer her to the gynecology department. But Professor Taiju intervenes, reminding him of the protocol for critical cases, which includes securing an IV line and running blood tests first. He adds that before transferring her, they should at least perform an abdominal ultrasound, as the pain's location could be due to a ureteral stone or an ectopic pregnancy. The doctor realizes his diagnosis was based solely on his experience and apologizes, admitting he was too hasty in his judgment. The professor orders Hee-cheol to take over the examination and asks the doctor to step aside. The doctor feels regret, not because he spoke decisively, but because he wasted time while the patient was in pain, thinking that immediate surgery is the best way to reduce the pressure on her body. Later in his office, Professor Taiju reflects on the situation, acknowledging that he might have been too quick to judge the intern due to the pressure of setting up the new department. The fellow, Shin Hee-cheol, knocks on Professor Jiang Taiju's office door and asks for permission to enter. The The professor asks him about the patient Lee Sunmi's condition, and Hee Cheol informs him that the pregnancy test was negative and the abdominal ultrasound showed no lesions, so she was transferred to the obstetrics and gynecology department, who discovered an ovarian torsion, and the patient is undergoing emergency surgery at this very moment. The professor rises from his seat in shock, asking if this means Lee Min-ho's initial diagnosis was correct, which Hee Cheol confirms. The professor is baffled as to how Min-ho could diagnose ovarian torsion by palpation alone, considering it impossible even for him, and concludes it must have been a sheer coincidence. Hee Cheol agrees, but the professor adds that the young man possesses a sharp instinct, like a chick that has just hatched from its egg. Out of curiosity, the professor decides he wants to give him a chance to examine another patient, which surprises Hee Cheol, who thinks this might be going too far if the first diagnosis was just a stroke of luck. But the professor insists, explaining that he cannot accept the idea that it was just a coincidence, and that the matter must be clarified for Min-ho so he doesn't get arrogant about his supposed skill. As the saying goes, lightning doesn't strike twice. Meanwhile, the doctor was sitting in front of the computer, reflecting on the test results that confirmed his diagnosis. He realizes that intuition is important, but in the era of modern medicine, minimizing risk is more crucial, especially from the patient's perspective. Hee Cheol suddenly interrupts him, asking if he's eaten, then tells him to leave his food for later and come with him. Hee Cheol takes him to another patient suffering from a headache. Her husband explains that his wife suddenly felt nauseous, lay down on the sofa, and then started vomiting. The doctor begins taking notes and examining the patient, noticing that her pupils are normal and her consciousness is clear. But the patient suddenly asks if he is just an intern. When the doctor confirms his identity, the patient expresses her wish to be examined by an older doctor, questioning if he could really provide an accurate diagnosis. Professor Tae-ju intervenes to reassure her, confirming that Dr. Lee Min-ho is skilled and she can trust him, but she insists she would prefer someone more experienced. The doctor thinks to himself with amusement how people in the past used to line up to be examined by him, and now he is being rejected. He calmly explains that professors usually don't provide direct treatment but rather review diagnoses and results. He asks her to undergo the basic examination with him first, after which the professor will give the final assessment. The patient is convinced and reluctantly agrees, so the doctor begins by asking her when the headache started. The patient continues to describe her symptoms, explaining that she was preparing lunch when the pain suddenly started. She felt nauseous, so she lay down and the pain subsided a bit, but it returned stronger when she got up, and the nausea worsened to the point of vomiting. The doctor listens to her description and realizes her consciousness seems clear. He asks her to wait a moment and examines her eyes, finding that her pupil size is normal and the light reflex is intact. He connects the symptoms, the severe sudden headache with vomiting, to the classic signs of increased intracranial pressure due to a subarachnoid hemorrhage, a ruptured artery on the brain surface that can cause serious damage. Based on this strong suspicion, the doctor decides that a head CT scan must be performed immediately. When the patient's husband tries to help her up, the doctor stops him firmly, explaining that she cannot move and must remain completely still, and that she will be transported on a stretcher. The husband is surprised by this measure, especially since his wife walked into the hospital. The doctor asks for his cooperation, stressing the need for extreme caution. The husband reluctantly agrees, while Professor Jang Tae-ju watches the situation with interest. While the patient is being transported, the professor asks the doctor why she is being moved on a stretcher. The doctor explains that he suspects a subarachnoid hemorrhage and that minimizing intracranial pressure is the optimal course of action. Shin Hee Cheol thinks to himself sarcastically that ordering a CT scan directly is ridiculous, and that he will surely be reprimanded. But Professor Tae-ju surprises him, commenting that most doctors wouldn't immediately suspect a subarachnoid hemorrhage when a patient walks in, describing the doctor's intuition as sharp. He then decides to test his knowledge, asking which areas require the most attention when reading the CT scan for this condition. The doctor answers confidently that the most important is to check the pentagonal area, then the interhemispheric fissure, followed by the sylvian fissures and basal cisterns, explaining that any density in these areas is considered abnormal, and that a noticeable expansion of the temporal horn is also a strong sign. The professor is impressed by his extensive knowledge and praises him, then tells him to go finish his reports. After the doctor leaves, Hee Cheol wonders aloud if this was just a coincidence again. But Tae-ju replies that the patient's symptoms were very clear, so could it be considered a coincidence? Saying that credit should be given where it's due. He explains that the doctor's insistence on transporting the patient on a stretcher was not luck, but knowledge born from serious study, and Hee Cheol agrees. The professor adds that the doctor spoke with confidence and calm and was professional with the patient, deciding enthusiastically that the next time they have an emergency surgery, he will be sure to bring him along. That evening, the doctor felt a sudden sharp pain in his stomach, connecting it to the thought of chow chow that had crossed his mind earlier, and to the fact that he had eaten his meal in a hurry. He recalled how chow chow had died shortly after him, and that if he had listened to his advice, he would have survived. As the pain intensified, the doctor resorted to an old habit and grabbed a needle to prick himself, but Shin Hee-cheol caught him by surprise, asking what he was doing. He explained he had indigestion, and Hee-cheol scolded him, saying he should take medicine instead of resorting to unscientific remedies in a hospital. The doctor realized he had reverted to his old habits and apologized. Hee-cheol went easy on him and told him to claim he accidentally pricked himself if anyone asked. The doctor thought to himself how doctors of this era reject old methods, and wished he could test his techniques to see if they still had value. Suddenly his thoughts were interrupted by a ringing phone. The nurse took a call and announced in shock that there had been a massive car accident. She informed the doctor about a 10-car pileup on the river road, with a large number of casualties. The doctor immediately called Professor Jang Taiju for instructions, and then told the nurse they could receive up to 20 people. Outside, a group of doctors were grumbling about the accident happening during rush hour. They wondered why they were all summoned, when the hospital doesn't have a specialized trauma center, complaining that the administration was trying to establish one just to increase their workload. Professor Jiang appeared and apologized to them, commenting that he believes saving a patient's life is worth a little scolding from his wife. The doctor observed the situation, impressed by the professor's calmness and character, which reminded him of the great men he had met in the past. Ambulances began to arrive, and the medical team rushed to receive the injured. Professor Jiang took the lead, directing everyone with speed and efficiency. One doctor received the case of a young man who had crashed his car into a guardrail, only to be shocked to discover the patient's leg was amputated. Immediately, the doctor yelled for his colleague to contact the anesthesiology department and open an operating room urgently. A new patient named Shin Dong-cheol, 31 years old, arrives at the ER, found with a steel plate embedded in his lower right abdomen. A doctor tries to intubate the patient, asking him to open his mouth, but the patient is in too much pain to do so, which makes the doctor, in Minho's body, realize the gravity of the situation. While the fellow, Shin Hee-cheol, is working on securing a central venous line, the doctor decides he has to try something, thinking there must be a faster way to intubate. Hee-cheol warns him not to try putting his finger in the patient's mouth, but the doctor reassures him that he has a different method, and he applies pressure to specific nerve points on the patient's face, forcing his mouth to open involuntarily. The other doctors are shocked and ask him how he did that. The doctor replies that he saw a similar video before and urges them to hurry with the intubation. After the procedure succeeds, Professor Jang Taiju decides the patient needs immediate surgery and orders the anesthesiology department to be contacted and an operating room to be opened, assigning the 3 interns to assist. Hee-cheol tries to object, but the professor cuts him off, saying the general surgeons are busy and that he will perform the surgery himself and just needs their help. In the operating room, the examination reveals severe internal injuries as the patient's right spermatic cord has been severed. The doctor realizes that reconnecting the severed structures is a complex procedure that requires a long time, and wonders if Professor Jang, who focuses on saving lives, will bother with this delicate anastomosis. The doctor observes the professor's performance, noting that his speed is high but lacks precision. He thinks that if he were the one performing the surgery, his performance would be better. The professor asked the doctor to cut at the spot he indicated, and he noticed the cut was the perfect length, which made him certain the young man had been in the operating room many times. After a while, the professor finishes the critical parts of the surgery, commenting that the surgical sites were difficult but it ended well, and that the patient was lucky to have avoided impotence. The doctor is surprised by how quickly the surgery finished, and asks the professor if he will perform the spermatic cord anastomosis. The professor replies that although performing the anastomosis would be better for the patient, there are countless other patients in the ER waiting for surgery who are on the verge of death, and explains that he cannot do more for a patient who has passed the critical stage. The doctor understands his decision, realizing this is what he had expected. The professor then asks Hee-cheol to finish the remainder of the operation, and leaves the operating room. After the professor leaves, Shin Hee-cheol turns to the doctor, Lee Min-ho, and asks if he has ever finished wound closures before, to which he replies that he has done it several times. Based on this, Hee-cheol decides to give him the chance to complete the current operation, explaining that he wants to see his skills for himself and will intervene if his performance isn't good. The doctor agrees confidently but surprises everyone by requesting a very fine 10-0 nylon surgical suture. He calmly announces that he will perform the spermatic cord anastomosis. One of the assistants erupts in anger, accusing him of being arrogant after receiving some praise. But the doctor insists on his position, asserting that it's a simple anastomosis that can be done quickly and that he feels sorry for the young patient. Hee-cheol argues that it's not that simple and that an intern shouldn't perform such a procedure, adding that if he were the patient, he would have kicked him out of the room. The doctor pleads with them to trust him, assuring them that he is perfectly capable of performing this surgery. After a moment of hesitation, Hee-cheol smiles, commenting on the doctor's stubbornness, and agrees to his request. saying he will assist him to save time. The doctor begins the anastomosis with amazing skill and precision, while the other doctors provide the necessary assistance, leaving them in a state of complete awe. Hee Cheol asks if he is really just an intern, and he simply replies that his dream is to become a surgeon, so he has practiced suturing a lot. But Hee Cheol thinks to himself that this intern's skills surpass even Professor Yang's. After the surgery ends, and calm returns to the ER, the interns gather in the doctor's room, exhausted. Hee Cheol comes in and tells them that their colleague Manhwa is truly amazing. He recounts how he went into the operating room with him, and how Manhwa performed the spermatic cord anastomosis with absolute perfection. He jokes that the young man must be living at least his second life as a doctor and advises them to be grateful to have him around. Both Jisoo and her colleague could clearly see that Manhwa was an unusually outstanding doctor. Hee Cheol also mentions how he amazed them with his technique for making the patient open his mouth. Out of curiosity, he asks the resident Cha Sang-sik to lie on the bed, so he can try to imitate the technique, and after several failed and comical attempts, he finds a pressure point on his colleague's neck and presses it hard. After Cha Sang-sik pressed the pressure point, his colleague screamed in pain, causing him to back off and apologize. But his other colleagues, Byun Hee-woong and An Ji-soo, ignored his pleas and went back to work, leaving behind another quiet day in the emergency medicine department. Later, Byun Hee-woong was standing alone on the hospital roof, worried and sad. He was recalling a scolding he received for a mistake he made with a patient with a pneumothorax, where he had failed to notice the collapsed lung on the X-ray and couldn't find anything to say to justify his mistake. He compared himself to his colleague Lee Min-ho, who was doing so well, and wondered about his own constant problems, thinking that perhaps he lacked the necessary talent. Meanwhile, the doctor went up to the roof after a long night, feeling relieved that the situation had calmed down. He spotted his colleague Hee-woong standing alone and approached him, asking if he had also come out for some fresh air. The doctor noticed that Hee-woong seemed depressed and tried to console him. Hee-woong confessed that he felt very jealous, as he was always making mistakes and getting scolded. The doctor realized his colleague was frustrated. Hee-woong continued to complain, admitting he was starting to fear seeing patients, afraid of making the wrong decision, and was beginning to doubt if medicine was the right path for him. The doctor condemned this logic, asking if the fear of being scolded was so terrifying that it stopped him from seeing patients, and if he would be able to examine them better if he received some praise. He reminded him that every patient comes in with a different condition, and praise or blame has nothing to do with their diagnosis. He explained that a correct diagnosis means the patient gets the right treatment faster, while a wrong one prolongs their suffering. He asked him sharply if he was saying he couldn't make a diagnostic decision for fear of being scolded by his superiors, describing it as putting the cart before the horse. And Hee-woong seemed to be affected by his words. The doctor admitted that it's of course difficult to be scolded, remembering the countless insults he had received in his past life, but he stressed that if the scolding is due to a lack of skill, a doctor must accept it and study harder because it's a matter of the patient's life or death. He added that they are still interns, and even if they make a mistake, there is a resident to correct it, which saves them a lot of trouble. These words moved Hee-woong, who realized that what Manhwa had just said reminded him of something he had forgotten. He remembered that when he first dreamed of becoming a doctor, all he thought about was helping patients. But after starting his internship, the constant scolding and the patients shouting had made him lose sight of that goal. Byun Hee-woong continues talking with the doctor, admitting he had been so busy with work that he forgot why he wanted to become a doctor. But he adds that thanks to their conversation, he once again remembered his ultimate goal. He wants to help patients return home in good health. The doctor feels relieved, and Hee-woong affirms that he shouldn't let the scolding get him down, and that he needs to pull himself together and study harder, wondering what the patients did to deserve his mistakes. The doctor sees in his colleague's determination that he will become a good doctor in the future. Hee-woong admits he had been a bit jealous of Manhwa because he was always being compared to him, and the doctor reassures him that anyone can feel that way. Hee-woong comments that his way of speaking is like his grandfather's, to which the doctor jokingly replies that it's probably just his imagination. As they are heading back to the hospital, the fellow Shin Hee Cheol and the resident Cha Sang-sik run towards them. Hee Cheol asks the doctor to show him again how he made that patient open his mouth, admitting he tried to imitate the move and failed, and now Sang-sik's neck is stuck. With a quick touch, the doctor fixes Sang-sik's neck, who is surprised to find it back to normal. Hee Cheol gets excited and wants to try the move himself, but Sang-sik backs away in fear. The doctor explains that stimulating the acupuncture point requires applying very strong pressure. To prove his point, he takes a walnut out of his pocket, explains he sometimes uses it to massage his hand, then easily crushes it in his fist, clarifying that the difference lies in the force. Meanwhile, a new patient arrives at the ER limping. He recounts that his motorcycle slipped on the wet road and he fell. The doctor began to uncover the patient's leg to examine the wound. The examination reveals a severe wound on his thigh. The doctor begins his checkup, asking him to move his toes, and testing the sensation in his foot, making the patient scream in pain. The doctor concludes that the wound is large but just a simple laceration, and that the bones and nerves seem intact. Hea Cheol decides they will remove the foreign bodies from the wound and disinfect it, but first, they will give him a tetanus shot. And then he asks the doctor to handle the wound treatment. The doctor begins cleaning the wound using high pressure to remove the dirt. A paramedic explains that the patient was more worried about delivering his order than his injury, and that if he hadn't been there, the man would have gone to finish his job, and the patient endures the pain of the cleaning patiently. The doctor advises the patient to avoid riding his motorcycle on rainy days, but the patient replies that he has to make a living. The paramedic intervenes, explaining that this man has a young daughter he is raising alone, and that he always advises him to take care of his health first so he doesn't leave his daughter alone, but he's very stubborn. The doctor comments that it's hard to be a father. This incident brings back memories from his past life, where he saw many patients in similar situations. He remembers how fathers would do their utmost to save their children, even if it meant searching the mountains for a rare herb in bad weather, and how they would beg him to heal their children. The doctor realizes that the hearts of fathers don't change, whether in the past or the present. While he is suturing the patient's wound, Shin Hea Cheol watches him with admiration, noting that his skills are always amazing and how he perfectly performs a mattress suture on a long wound. Hea Cheol reassures the paramedic that Dr. Lee Min-ho is the best at suturing in the department and that he will do a wonderful job without leaving a scar. After finishing, the patient and the paramedic thank the doctor. The doctor speaks with the patient, expressing his understanding of his situation, but asks him how his daughter would feel if she saw him injured, and advises him not to work on rainy days and to spend more time with her. After a long day at work, the doctor returns to his apartment and begins practicing the 5 animals frolic, a form of meditation he believes will help improve his stamina. Suddenly, he notices a box at his door. He reads the sender's name, Oh Myong-soon, and realizes it's Lee Min-ho's mother. He opens the box and finds side dishes, tasting them and marveling at their delicious flavor. At that moment, his phone rings, and he hesitantly answers to find it's Min-ho's mother. She asks if the dishes arrived, and he tells her he just received them. The mother notes that he's speaking to her formally and tells him she sent his favorite dishes. The doctor lies to reassure her, saying that everything is fine and he's receiving a lot of praise. The mother expresses her relief and tells him to take care of himself. After ending the call, the doctor feels guilty for no clear reason. He thinks that he didn't take Lee Min-ho's body by force, and concludes that the only thing he can do is to live more earnestly. The doctor decides to live more earnestly so as not to tarnish the reputation of Lee Min-ho and his family. But he faces a new dilemma: how to deal with all the food his mother sent, as he fears it will spoil. Then a brilliant idea strikes him, to take some of the food to the hospital to share with everyone. In the office of the ER department head, Bong Sa-gil, Professor Jang Tai-ju asks about the large number of traffic accident patients they received. Professor Jang apologizes, explaining he didn't expect other department heads to complain. Bong tells him to consult with him first to avoid friction with other departments. Professor Jang apologizes again, admitting his thinking was short-sighted. Bong reminds him that he is not a graduate of this university and asks him to be more careful, then dismisses him. After leaving, Professor Jang thinks to himself that he didn't mean to be arrogant, and remembers that from day one, he felt that Bong didn't like him, wondering if he sees him as a threat. During his rounds, Professor Jang reviews patient Shin Dong-cheol's file. He scolds Shin Hea Cheol because not only did he finish the operation as requested, but he also reconnected the spermatic cord. The professor praises his work, admitting he thought the step would be too difficult for him. But Hea Cheol hesitates before telling him the truth, that it was the intern, Lee Min-ho, who performed that delicate anastomosis. In his office, Professor Jang watches the video recording of the surgery. He is shocked by what he sees. He sees how Min-ho's hands moved with lightness and rhythm, and how the stitches were uniform. He wonders aloud how they could be so fast and precise at the same time, and if this is really an intern's skill. He rules out the idea that the cardiothoracic surgery department could have trained him to this level in a short time, and comes to one conclusion: Lee Min-ho must be a natural-born genius. The professor realizes the cardiothoracic surgery department has already set its sights on Min-ho, but he decides that won't do, and that he must recruit him to the new trauma surgery department no matter what it takes. Meanwhile, the doctor was in the break room, discovering his colleagues had eaten all the food Min-ho's mother had brought, which he had intended to share with everyone. His colleagues enthusiastically tell him his mother's food is the best and ask him to pass on their thanks to her. Cha Sang-sik notices the situation and approaches the doctor to tell him that the department head, Bong Sa-gil, wants to see him. While in the break room, the doctor overheard his resident colleague, Hea Cheol, complaining to Dr. Cha about their department head, Dr. Bong. Sang-sik explained that Bong was very sarcastic about the rumors that Hea Cheol was looking after Professor Jang in his absence. Cha wondered about the source of these rumors, and Hea Cheol replied that the chief resident, who follows Dr. Bong around all day, is the one spreading them. Cha sighed, saying that in the end, they are the only ones who suffer. The doctor listened to their conversation, surprised that turf wars existed even in a hospital, as if they were animals. At that moment, Cha Sang-sik entered and told the doctor that the department head, Bong Sa-gil, was looking for him, and the doctor wondered why the department head was suddenly looking for him. He went to look for him and found him at the reception desk, where he was told he had been looking for him. Bong smiled mysteriously, saying his presence here was perfect as he had an urgent report for him, all while realizing that this was the young man, Lee Min-ho, who had caused all the commotion. A short while ago, Bong had questioned the chief resident about a patient admitted the previous day for a subarachnoid hemorrhage, asking why no other tests besides the CT scan were performed. The chief resident, Moon Sung-ryong, explained that Lee Min-ho was the one who suspected the condition and ordered the CT scan immediately. Bong remembered the name Lee Min-ho and the previous incident that had angered Professor Huang. Sung-ryong continued, revealing that Professor Jang had been testing Min-ho and that he had managed to diagnose a case of ovarian torsion by palpation alone. Bong dismissed this and asked about Min-ho's family background, but Sung-ryong denied he was from a family of doctors, explaining his parents were simple farmers. He added that, most surprisingly, Min-ho had even closed surgical wounds himself several times. In the present, a new 47-year-old patient arrived after losing consciousness. Bong decided to put Min-ho to the test again and asked him to diagnose his condition. Bong thought to himself that no matter how much one studies, diagnosing patients is not something anyone can do, and that while Professor Jang was trying to win over Hee Cheol, there was no harm in winning a talented intern to his side early on. The doctor began examining the patient, who confirmed his annual checkups were always normal. His vital signs showed low blood pressure with a rapid pulse, which the doctor immediately diagnosed as an early sign of shock, a symptom that appears when a ruptured blood vessel causes blood loss. The doctor immediately ordered a liter of saline to be administered. He then asked the patient if there were any warning signs, but the patient denied it, saying everything suddenly went black. By checking the patient's irregular pulse and pale face, the doctor deduced he was likely suffering from gastrointestinal bleeding, but he remembered the established protocol and decided to stick to it, asking the nurse to prepare the patient for an ECG first. The doctor thinks to himself that if he had inserted a nasogastric tube, he could have diagnosed the illness immediately. The department head Bong approaches him and points out that since the doctor ordered saline to be given quickly, he must believe there's a high probability of shock, and the doctor agrees, explaining he believes the problem is likely gastrointestinal bleeding. The chief resident, Moon Sung-ryong, intervenes, calling the doctor's diagnosis hasty and reminding him to consider all possibilities. The doctor calmly replies, explaining that the symptoms don't align with a subarachnoid hemorrhage or aortic dissection, which the patient did not exhibit. For this reason, he believes it is logical to assume the fainting was caused by gastrointestinal bleeding, which leaves Sung-ryong speechless. At that moment, the ECG results arrive, and the doctor smiles confidently and suggests they begin the examination. During the abdominal ultrasound, it becomes clear there are no signs of intraperitoneal bleeding, which strengthens the possibility of bleeding in the stomach or intestines. Bong asks the doctor for his opinion on the source of the bleeding, and he confidently replies that he believes it's from a stomach ulcer. Based on this, the doctor asks a nurse to prepare a nasogastric tube. The doctor explains to the patient that they will insert the tube to drain the blood and then locate the bleeding site. He begins inserting the tube, telling the patient to breathe normally, aware that he must guide it carefully toward the esophagus. He asks the patient to swallow the tube, and he complies, which impresses Bong, who notes his easy rapport with patients. Shortly after, the patient's vital signs stabilize, and Bong concludes the bleeding must have stopped. The doctor explains the bleeding has temporarily stopped due to the cold irrigation fluid but could start again. He suggests informing the internal medicine department, and Bong agrees, then asks him to come to his office for a moment. The doctor didn't feel worried, as he had anticipated this. In the office, Bong offers the doctor a cup of tea and praises him, admitting he performed better than expected. Then he asks him directly what specialty he is considering, and the doctor realizes this is his true goal. When he tells him he's thinking about surgery, Bong tries to dissuade him. Bong explains the importance of work-life balance, noting that surgery professors rarely show up for social events. He lists the disadvantages of surgery, from exhaustion to lawsuits, and suggests that emergency medicine is a much better option. He then makes his offer, promising that if he joins their department, he will ensure a shorter fellowship and a swift appointment, which shocks the doctor. The doctor wonders to himself at this exaggerated offer. He realizes there's always a hidden reason, and concludes it's not really about Bong wanting him, but more likely that he doesn't want Professor Jang Tae-ju to benefit from him. The doctor reflects on the nature of power, having seen how influential people act. They lure you with sweet words when they need you, then discard you without hesitation. He decides it's best to play along for now, thanks Bong for his offer, and promises he will seriously consider emergency medicine. In the crowded ER, a new patient arrives. A worker crushed under a forklift, resulting in severe abdominal bleeding and an open fracture in his leg. Professor Zhang rushes to handle the case, assigning Lee Min-ho and Dr. Yu to assist him and ordering them to prepare blood bags. The two doctors immediately agreed to carry out the orders. After some time, the intern Byun-hee Wong was waiting, thinking the urgent part of the surgery must be over by now, and he curiously wondered if the professor would let Min-ho finish this surgery too, as he wanted to know how skilled his colleague truly was. But he no longer felt the jealousy he used to. Dr. Cha told a patient she would have her blood test soon and asked her to wait. Meanwhile, Hee Wong asks for permission to go to the bathroom, and Cha Sang-sik reluctantly agrees, so Hee Wong rushes out. Hee Wong decides to take a quick peek into the operating room. He sees the medical team struggling to locate the source of the internal bleeding. Professor Zhang realizes that the minor bleeding is the real problem. The doctor, in Min-ho's body, remembers seeing similar cases in the past with knights falling from their horses, where trauma to one side of the body causes organ rupture on the other. Based on his experience, the doctor notices slight bleeding in the liver and tells the professor, pinpointing its location around Cantley's line. From this precise identification, the professor deduces the bleeding might be from the middle hepatic vein and decides to open the wound a little more, towards the liver to confirm. After Professor Zhang Taiju opened the wound further, he was able to identify the source of the bleeding and control it. Then he smiled and asked the nurse to prepare the surgical sutures. In the viewing room, the intern, Byun-hee Wong, was surprised to find his colleague An Jisoo there. Hee Wong explained that he was curious to see if the professor would let Min-ho close the wound this time as well, and Jisoo told him that the professor had already assigned him the task. Jisoo continued, revealing to the astonished Hee Wong that Min-ho was now suturing the visceral peritoneum, a procedure much more difficult than suturing skin, yet he was doing it with complete calm. Jisoo added that Min-ho was the one who discovered the source of the bleeding that the professor couldn't find, and that his skill couldn't be just luck, with which Hee Wong agreed. The latter felt extremely embarrassed for having felt inferior to someone with such skill, and whenever he saw him, he felt the gap between them widening even more. Then, Jisoo and Hee Wong received calls from their doctors telling them to return. After the surgery ended, the patient's vital signs stabilized. The doctor commented that Professor Zhang's quick decision to operate was brilliant and saved the patient's life, asserting that his handling of emergencies was the best in the hospital. The professor praised everyone's performance, singling out Min-ho for praise, saying his wound closure looked even better than what he saw in the video recording. The professor surprised everyone by promising Min-ho he would let him perform an appendectomy soon. One doctor objected that Min-ho was still an intern, but the professor retorted that it didn't matter as long as he was better than most chief residents, and that his internship would be over in 2 months anyway, a point another doctor supported. The professor asked Min-ho if he was confident in his ability, and he replied enthusiastically, "Of course." The professor smiled and promised to give him the opportunity as soon as possible. The doctor felt overjoyed, because the chance to lead a surgery himself was finally approaching. In another scene, at an airport cafe, a man in summer clothes was sipping a tropical drink when he received a sudden phone call, and he wondered how the caller knew he had just arrived in Korea. In the cafe, the department head returning from his vacation, Professor Hwang In-bong, answers the call. The caller asks if he enjoyed his vacation, and Hwang replies that he got a good rest. Hwang comments that he bets Professor Kim was performing several major surgeries a day, adding that if he overworks himself, he'll regret it later like he did, and the caller agrees. The caller then asks Hwang if he remembers the intern Lee Min-ho. Hwang remembers him immediately and asks sharply if that scoundrel has caused trouble again, but the caller surprises him by saying the opposite is true. Recently, the intern has been receiving widespread praise throughout the hospital. Hwang is completely shocked and yells into the phone, asking who is giving him this praise. Meanwhile, Dr. Lee Min-ho was studying hard for the appendectomy. He reflected on how this surgery in the past required a wide abdominal incision, whereas in modern medicine, using a laparoscope, only a small incision is needed. Elsewhere, his fellow interns were talking about him, expressing their astonishment that as an intern, he had already gotten the chance to perform a surgery, and they felt the skill gap between them and him was widening, with one even calling him a monster intern. The fellow, Shin Hee-cheol, observed the situation, wondering to himself just how far Min-ho's hidden skills went. In his office, Professor Hwang meets with Kim Hyung-seon. Hwang asks about his vacation, and Hyung-seon replies that he heard strange things about the praise Lee Min-ho was receiving. He recounts how he returned as a completely different person overnight, with surgical skills surpassing many. Hwang gets angry, refusing to believe it, and questions how someone who doesn't even know if a patient is alive or dead could be anything but incompetent. Hyung-seon tries to defend Min-ho, explaining the situation at that time was critical, but Huang interprets this as an accusation, so Hyungseon backtracks and blames the patient's family. Hyungseon tells the professor that Minho has announced he will apply to the cardiothoracic surgery department. Huang's anger grows, and he wonders why he would do that. Believing Minho is deliberately trying to provoke him, he firmly declares that he would never accept an intern like him, who brought a deceased patient into the operating room. In the operating room, the appendectomy begins. Professor Jang orders Dr. Lee to start. The doctor calmly asks for the scalpel and makes the first surgical incision. Professor Jang notes his surprising calmness for someone holding a scalpel for the first time. The doctor focuses on the next step, which is to separate the layers connected to the appendix's mesentery. He first clamps the tissue firmly with forceps, then cauterizes the area and ligates the appendix with a surgical thread. Professor Jang notes the speed of the procedure, realizing the credit goes to the doctor's speed in making the abdominal incision. After removing the appendix, the doctor examines it and tells the professor he thinks it might be an appendiceal mucokel. The professor is impressed by his sharp observation and asks Shin Hee-cheol to take the sample to the pathology lab, thinking to himself that the professor is giving him this task to lighten the load on Minho, who will be doing the suturing. The professor discusses the possibility of the mucosal rupturing with the doctor, but the doctor reassures him that he has examined all surrounding structures, which impresses the professor once again. The biopsy results arrive and confirm the tumor is benign, so the professor tells the doctor to go ahead and close the wound. After the surgery, Professor Jang praises the doctor's calmness and performance, confirming that thanks to him, the surgery went very smoothly. The doctor feels an overwhelming joy he hasn't felt in a long time, happy to be able to treat patients again, and hopes to participate in more operations soon. Later, as a thank you, An Ji-soo invites her colleagues to a dinner buffet. The doctor is amazed by the variety and abundance of food, which surprises his colleagues, who comment that he's acting like someone seeing a buffet for the first time. The doctor enjoys the food with a great appetite, while his colleagues watch him with amusement. Back at the hospital, Jisoo asks the doctor for help with a new case. She explains that the patient is 77 years old, took cold medicine but her symptoms worsened, and she developed chills and difficulty walking. The doctor reviews her vital signs, noting she has a fever and unstable breathing. He suspects sepsis, and Jisoo agrees, adding that the lab results show a significant rise in liver enzymes and bilirubin. The doctor deduces there's a high probability of cholecystitis or cholangitis. He asks Jisoo if Dr. Woo In-hai had noticed any pain when palpating the patient's abdomen, then concludes himself that as an elderly patient on certain medications, she likely wouldn't react to moderate pain. He confidently assures Jisoo that if she focuses on the bile duct during the ultrasound, she will definitely find something abnormal. While performing the scan, Jisoo indeed discovers what appears to be a stone in the bile duct. Dr. Woo In-hai praises An Jisoo's performance, who thinks to herself how Lee Min-ho's personality changes completely between the hospital and the restaurant. In his office, Professor Jang Taiju stares at the calendar, realizing the Chuseok holiday has arrived. He sighs sadly because since choosing to specialize in trauma surgery, he hasn't had a single day off. He anticipates his wife will pressure him again and feels like he himself is about to become a patient. Additionally, he was worried about the expected chaos in the ER during the holiday, wishing Lee Min-ho were a resident to lighten some of his burden. Suddenly, Professor Jang receives a phone call, informing him of a fall at a construction site and that the patient is on his way to the hospital. The professor asks about the height of the fall, and the caller tells him the man fell from the 3rd floor. The caller describes the severe injuries. An iron rod pierced his abdomen and exited through his back. His ribs also seem to be broken, but he is in a coma. The professor curses the situation and orders the caller to contact the anesthesiology department and open an operating room for an emergency case. In the ER, the doctor spots someone approaching and realizes from Lee Min-ho's memories that it's the department head, Hwang In-bong, the man who ordered him to be placed on continuous night shifts. The doctor remembers that Hwang is a typical petty man, flattering his superiors and crushing his subordinates. Hwang arrives and is greeted by Professor Jang. Hwang sarcastically addresses Professor Jang, gesturing toward Dr. Lee Min-ho and questioning how interns are trained in the ER, since one of them didn't even greet him. Professor Jang asks the doctor if he greeted the department head, and he replies that he did, even though he actually hadn't, realizing that Hwang would find a reason to insult him no matter what. Hwang claims he doesn't remember receiving any greeting and insists he must do it again. Then he scolds him for staring. The doctor calmly replies that he was happy to see him after a long time, but wonders to himself if repeating a greeting is a ritual for the dead. Hwang is shocked by the insolent reply, while other doctors whisper in the background, impressed by Lee's boldness. Before the situation can escalate, another ambulance arrives. the patient is brought in on a stretcher, and the medical team immediately begins to handle the case. An initial X-ray reveals that a rib has likely pierced the lung and heart. Professor Jang realizes they will need to use an extracorporeal membrane oxygenation (ECMO) machine and orders it to be prepared. Professor Jang decides there's no time to wait for a CT scan. He sees that the steel rod has pierced the stomach and grazed the pancreas and spleen, and that the patient's survival is a miracle. He thinks to himself that the mortality rate after such an operation is very high, but he makes his decision and orders the patient's chest to be opened, planning to take turns with Professor Kim Joo-hyuk. Hwang objects, reminding him that Professor Kim is in a difficult surgery now that will take at least 4 hours. Hwang tries to discourage Professor Zhang, but the latter urges him to have confidence in himself. Hwang replies bitterly that once Zhang gets sued a few times, he'll understand his feelings. Dr. Lee Min-ho sharply asks him if he's going to abandon the patient if Professor Kim doesn't come, and Hwang hesitantly replies that they'll have to try somehow. Professor Jang makes his decision, orders the patient to be moved to the operating room, and asks Shin Hee-cheol and Lee Min-ho to assist him. Hwang objects angrily, questioning how he can use an intern as an assistant in such a critical surgery. He offers to send someone from his department to help, but Professor Jang refuses, insisting that Lee Min-ho will be sufficient. Hwang reluctantly gives in, warning Professor Jang not to regret his decision later. In the operating room, the professor explains that as soon as they start the surgery, blood will gush out, and he orders them to keep the suction device right at the tip of the scalpel. After anesthesia is complete, the surgery begins. As soon as the professor begins to remove the steel rod, blood gushes out forcefully, but Dr. Lee manages to help control the main bleeding quickly, thanks to his fast reflexes. After gradually controlling the bleeding, the team is ordered to remove the steel rod completely, but Professor Jang remains worried about when Professor Kim will arrive, fearing they might need to put the patient on life support. With no other choice, he orders the patient to be given a cardiac stimulant, and Hwang decides to proceed with removing the broken rib himself, giving instructions to an assistant. During the procedure, another massive hemorrhage occurs, and the patient's heart suddenly stops. Hwang remains calm and successfully identifies the source of the bleeding. Dr. Lee Min-ho watches the situation with admiration, realizing that despite Hwang's poor personality, his judgment and skills as a department head are excellent. Hwang discovers that fortunately, the rib did not pierce the heart muscle. He begins to suture the heart, then performs a direct cardiac massage, a very rare and delicate technique, which astonishes Dr. Lee. He comments to himself that regardless of Hwang's personality, his skill is incredible, and wonders if the fear of lawsuits is what's stopping him from performing surgeries. Thanks to the direct massage, the heart rhythm returns to normal, and Professor Jang feels relieved, ordering another dose of the cardiac stimulant. After the critical surgery is over, Professor Jang praises Hwang, admitting his skills haven't rusted. Hwang apologizes, saying he had planned to avoid getting involved, but there was no other choice. Jang comments on the patient's amazing vitality, hoping he will wake up without complications. The medical team continues to work, and Professor Jang instructs Shin Hee-cheol that as soon as he finishes the intestinal anastomosis, Lee Min-ho will take over the vascular anastomosis. Hwang intervenes angrily, decrying how an intern could be allowed to perform such a delicate procedure. Zhang defends his decision, asserting that Lee Min-ho has the necessary skill and that he will take full responsibility. Hwang challenges him, saying he will refer him to the disciplinary committee if he makes the wrong decision. Professor Jang orders Dr. Lee to proceed. The doctor begins to work, but he feels the pressure of Hwang's watchful gaze. He reminds himself to focus. As long as the patient before him can still be saved, he shouldn't worry about anyone else's opinion. He believes the only thing a doctor should think about is chasing after life, which surprises Hwang, who thinks everyone in the room has gone mad. The doctor continues his work with superb skill. An assistant observes his outstanding performance and wonders if he deserves this opportunity. Meanwhile, Professor Kim Joo-hyuk arrives in the operating room. Hwang tells him he didn't need to come. Professor Kim notices the intern, Lee Min-ho, and is amazed that Professor Jang allowed him to perform the vascular anastomosis. Hwang tells him that Professor Zhang is putting a huge burden on Lee, to which Kim replies that they cannot afford to lose a talent like him. Hwang was annoyed by the others ignoring his directives. Elsewhere, the patient's sister was waiting anxiously. She receives a call from her brother and tells him her husband is in surgery now. She explains that the cardiothoracic surgery and trauma surgery departments are working on his case together. Her brother describes the horrific injuries he heard about but reassures her that death is unlikely with modern medical technology. He asks her to request a video recording of the surgery after it's over, because as a former doctor, he'll be able to tell if a specialist performed it properly or if a resident handled it negligently. He advises her to stay strong. After ending the call, the brother thinks to himself angrily, vowing he won't stay silent if a resident performed the surgery. Late at night in his private office, the injured patient's brother-in-law, a former doctor, was watching the video recording of the surgery. He commented that his brother-in-law's condition had been truly critical, then examined the list of the medical team's names, recognizing Professor Zhang Taiju and department head Huang Inbong, describing them as very famous professors. But he paused at another name and wondered in confusion about that doctor's identity. In the office of the head of cardiothoracic surgery, Professor Huang Inbong still couldn't believe what he had seen. He was thinking that with a little training, Lee Min-ho could even surpass Professor Kim Ju-hyuk in skill, and he wondered if this was the same young man he used to persecute. Huang receives a call from Lee Min-ho, who tells him he is looking for him, so he invites him in. Huang offers the doctor a drink and admits he had misunderstood him. He tells him that after seeing his skills, he finally understood why everyone's evaluations of him were so generous. He asks if he still plans to choose their department, and the doctor replies that it was his intention. But lately, he has been leaning slightly towards trauma surgery because of the opportunities Professor Zhang has been giving him. Huang understands that Professor Zhang is also determined to train him, and regrets to himself that if he had treated him better before, he wouldn't have changed his mind. Surprisingly, Huang offers the doctor an apology, admitting he was stressed due to the numerous malpractice lawsuits, and that although the previous incident wasn't an intern's fault, he had placed the blame on him. Huang apologizes again, and the doctor frankly replies that he had indeed crossed the line, but adds that it's all in the past now. Huang feels relieved, but the doctor tells him he has a request in return, to allow him to observe his surgeries on his days off. Huang is surprised by his request, but the doctor insists that watching on a screen is completely different from seeing it live. The doctor explains that he wants to learn directly by his side. He thinks to himself that although Huang's personality isn't the best, after seeing his skill, he realized the amount of effort he put into saving patients. He felt a desperate desire to truly save lives, and now understood why he was once called the best thoracic surgeon. The doctor expresses his hope to continue receiving his guidance, realizing it's better to build allies here instead of enemies. Huang is pleased by these words and suggests that instead of just observing, he should assist him in his operations, telling him that with his skill, he could even get a dual certification in 2 specialties one day. The doctor wonders if accepting the offer would mean taking opportunities from others, but Huang laughs and reassures him that assisting from time to time over 4 years would make getting a dual certification possible. The doctor agrees enthusiastically. Huang is pleased by this, noting that thoracic surgery has its own charm. Later, the medical journalist An Dong-hoon meets Professor Huang at the hospital cafe. An introduces himself, explaining that he was very impressed by the professor's appearance on a medical channel. He tells him he was deeply moved after watching the video of his brother-in-law's surgery from the previous day, and thanks him for performing it. An presents his proposal to the professor, explaining he is currently covering university hospitals to inform the public about the hard work doctors do, and asks if he could cover the thoracic surgery team during the holiday, adding that the hospital director has already approved. Huang appreciates the idea, but suggests it might be better to cover the ER since it's the busiest place. An adds that he looked up the names of the doctors in the surgery, and that Professor Zhang Taiju's team seemed extremely skilled, especially in the vascular anastomosis. Huang surprises him by saying that doctor is just an intern, which completely shocks An. Huang explains he has never seen an intern like him, and that this skill can't be perfected just by practice, leading An to think to himself that Dr. Lee might be an associate professor in another department. Huang tells the stunned journalist that Lee Min-ho is not only skilled at anastomosis, but his examinations are also precise, and he could be described as a genius. An is convinced that the public loves stories like this, and that if handled correctly, it will be a huge hit. In the ER, Professor Zhang announces that a journalist will be filming them during the holiday. One doctor objects that the presence of cameras won't please them or the patients, but Zhang downplays it, noting that cameras might deter drunk patients from causing trouble, and asks them to accept it. Then Professor Zhang drops another bombshell, announcing that from now on, the intern Lee Min-ho will always assist him in his surgeries, as he'll need to build surgical experience with the expected emergencies. The department head Bong Sa-gil intervenes angrily, asking who gave him the right to make that decision. Bong continues to scold him, saying anyone watching would think Professor Zhang is the head of the ER. Zhang apologizes, explaining he just wanted Lee Min-ho to gain more experience. Bong yells at him, declaring he cannot tolerate Zhang changing the intern training curriculum as he pleases. Professor Zhang backs down, realizing he understands the situation. Lee Min-ho thinks to himself that this was a good opportunity. What a shame. He believes Bong doesn't care about his performance as much as he cares about reining in Professor Zhang, and deplores how a patient's surgery could be a topic of discussion in a childish power struggle. Bong confronts Professor Zhang, rebuking him for agreeing to the filming without consulting him, and Zhang apologizes, saying he will be more careful in the future. Bong then summons Lee Min-ho. In his office, Bong tells the doctor he believes he has given him a lot of attention. He asks if he is still set on choosing trauma surgery, and the doctor confirms he prefers holding a scalpel in the operating room. Bong tries to dissuade him, reminding him that emergency medicine is a better option, but the doctor replies that he feels a happy life means doing what one wants. Bong tells the story of a former colleague who chose neurosurgery. The doctor asks about his fate, and Bong surprises him by saying that friend now runs a chicken restaurant, which is truly a shame. Later at a restaurant, Professor Jiang was sitting with Dr. Lee and asked if Chief Bong had really approved him entering the operating room. The doctor confirmed he got permission to assist in emergencies if Professor Jiang requested it, and the professor felt relieved. Returning to Bong's story, he explains that his friend operated on the son of a wealthy businessman, but the results were poor and he was sued. After years of trials, although he won the case, the severe mental stress led him to abandon the medical profession. Bong concludes his story by asking the doctor if he now understands why it's better for him to choose their department. The doctor expresses his sorrow for what happened, thinking to himself that the two department heads and the legal issues are indeed a big problem. But he remains firm in his desire to hold a scalpel. Bong calls him stubborn, but the doctor asserts that he fully understands the risks, yet he enjoys saving patients through surgery. Department head Bong Sa-gil concludes his conversation with Dr. Lee Min-ho, expressing his hope that the outcome of the choice he made today will be a good one. After the doctor leaves, he sighs, wondering why everyone is so foolish, as he used to think the medical profession was only about saving dying patients. Later, the doctor meets with Professor Jiang Taiju for a meal. The professor is surprised by the sudden change in the doctor's tone and asks if he was scolded by Bong. The doctor denies it but tells him the story Bong told him about his neurosurgeon friend who now runs a chicken shop. Professor Jiang smiles, realizing he must be talking about the chairman, Hua Tuo. The doctor corrects him, saying he's a president, not a chairman, making the professor joke to himself about how this young man from the past knows fewer words than he does. The professor clarifies that Hua Tuo owns a chain of stores across the country, so he is a chairman, and explains the franchise system to him and the brand he founded. The professor adds that he heard his business has been a huge success and he has amassed a great fortune, with dozens of stores in Seoul alone, and perhaps up to 100 nationwide. The doctor realizes that Bong completely deceived him with his sad expression while telling the story, and swears that if he falls for his words again, he won't be the son of the genius Dr. Hua Tuo, but the son of the foolish Chow Chow. With the arrival of the Chuseok holiday, the ER was, as expected, teeming with chaos. Doctors were rushing in every direction, with Professor Jiang ordering Dr. Cha to prepare for intubation, while Dr. Wu In-hai was discussing another case. In the midst of this chaos, Professor Jiang ordered Dr. Lee Min-ho to contact the anesthesiology department and assist in surgery. After a busy day, Professor Jiang wonders how many surgeries they've performed, and Dr. Lee tells him it was 6 in total. The professor feels exhausted, and just as he was hoping to get some rest, a nurse interrupted him to tell him that paramedics had called about another patient. The nurse describes the patient's condition as comatose with a crushed chest. The professor deduces that this case requires cooperation with the cardiothoracic surgery department and asks the nurse to tell the paramedics to contact the surgery department first. Meanwhile, Dr. Oh Guk-han receives a call from Professor Jiang, who informs him that a patient with a chest fracture is on their way. But Oh Guk-han apologizes, explaining that they cannot handle any more operations that day. Professor Jiang continues trying to persuade Dr. Oh Guk-han, explaining that the patient will surely die if they don't accept him. Guk-han expresses his regret, but confirms they have performed too many surgeries, that 2 patients had died during surgery, and they are now operating on another critical patient. Guk-han apologizes again, insisting it's absolutely impossible, and Professor Jiang understands the situation. After ending the call, he sighs in despair and asks a nurse to tell the paramedics they can't accept the patient. Dr. Lee Min-ho intervenes, asking if the professor is going to give up so quickly, and surprises him by asking for permission to take a look at the patient's chest. Professor Jiang dismisses the idea, explaining he can take responsibility for the abdomen, but not the chest. Dr. Lee admits he lacks experience but insists that if they give up, the patient will die without anyone even trying to help. Professor Jiang reminds him of the risk of a lawsuit. The doctor proposes a solution. He will clearly explain to the family that a cardiothoracic specialist is unavailable, and if they decide to forego the surgery, then he will give up as well. He thinks to himself that he cannot stand by and let a patient who can be saved die, and that if he uses what he has learned, the patient can be saved. After a moment of thought, Professor Yang reluctantly agrees, and the doctor thanks him enthusiastically. The ambulance arrives, and the medical team begins assessing the patient. They discover his systolic blood pressure is very low at 70, so Professor Jiang orders a liter of saline to be administered quickly. At that moment, a nurse rushes over, announcing the patient's family has consented to the surgery. The professor orders a quick scan and the booking of an OR in the operating room. The intern, Lee Sang-jik, from cardiothoracic surgery joins them. A doctor asks if he came to assist, and Sang-jik replies they should be grateful he came at all. The doctor thinks to himself that Gukhan is also having a tough time. Professor Jang assigns the roles, asking Sang-jik to stand by his side and Lee Min-ho to assist Shin Hee-cheol. Hee-cheol is surprised that Min-ho will handle the chest, but he figures Professor Jang will ultimately be the one to do it, as it's unreasonable to entrust such a task to an assistant. After anesthesia is complete, the final preparations for surgery begin after Professor Jang announced the start of the surgery, and as soon as the first incision was made, blood gushed out profusely. A doctor wondered about the source of the bleeding. Dr. Lee Min-ho deduced from the amount of bleeding and the oblique path that the source was the internal thoracic artery, a major artery that explains the severity of the bleeding. While Professor Jang was struggling to identify the source, he was surprised to see someone else's hand reaching toward the patient's chest. Dr. Lee calmly intervened, located it precisely, then clamped and stopped the bleeding. Dr. Lee Sang asked in amazement how he did it, and he replied that he predicted its location based on the site, color, and amount of blood, a reasoning that puzzled Sang. At that moment, Professor Jang ordered Dr. Lee to switch places with the other intern and tasked him with performing the anastomosis of the internal thoracic artery. The doctor asked for a needle holder and began suturing. Knowing it was best to restore blood flow as quickly as possible, Professor Jang watched his speed and precision, thinking to himself that this was the skill that left him speechless even when he overstepped his authority. He gave further instructions, explaining they now had to find and ligate the severed anterior intercostal arteries. While working, they discovered the pleural cavity was filled with air and blood. The professor admitted to himself that he had never directly handled a lung torn like this before, and wondered if he could do it well. At that critical moment, Dr. Lee intervened again. He told the professor that he has had the opportunity to handle lung lacerations several times while observing surgeries in the cardiothoracic department, and that the professors there had acknowledged his skills. He then asked the professor to just trust him on this one. Professor Jang considered the situation, realizing that any further delay would endanger the patient's life, so he agreed and ordered Dr. Lee Min-ho to proceed. The doctor announced he would incise the torn area and asked the assistants to prepare for suction, explaining he would keep the opening to a minimum to avoid overstressing the patient. He then began to suture the damaged area while the suction devices worked to remove the accumulated fluids and blood. After Dr. Lee Min-ho precisely sutured the torn lung, Professor Jang Taiju praised him, acknowledging that his suturing was extremely well done, and told him he could now remove the suction device. At that moment, Dr. Oh Guk-han entered the operating room after finishing his surgery. Professor Jang told him he had finally arrived and could now take over from Lee Min-ho. Guk-han was surprised to see that the lung had already been sutured. After examining the patient, he confirmed that the heart and bronchi were fine, and that there didn't seem to be anything else he could do at this stage, except for fixing the ribs. He expressed great relief and was amazed that Lee Min-ho had done all of that by himself. The doctor humbly replied that observing surgeries had been a great help to him. Guk-han was impressed by his skill and offered to let him close the wound under his supervision, to which the doctor agreed with great enthusiasm. The next day, the journalist An Dong-hoon was at the hospital to do a special report on Dr. Lee Min-ho. The doctor humbly wondered if there was really anything about him worthy of a special report, as he found the situation a bit distracting. The journalist asked him to act naturally and see patients as he normally would, but to pretend to be a little tired from time to time. The doctor was taken aback by the request to act. The journalist explained that the photos taken the previous day didn't truly reflect how hard his job was, and that he wanted to paint a picture of a young genius doctor beloved by the public, a doctor who burns away his youth out of a sense of duty to save patients. The doctor refused this, asserting that he shouldn't appear to be struggling in front of an anxious patient, that the sense of accomplishment is greater than the hardship, and that he didn't want to force himself to act in a certain way. Meanwhile, a nurse interrupted them, asking him to examine a new patient with a wound on her leg. The patient's mother was insisting that her daughter needed to be treated by a plastic surgeon. The nurse explained that on a holiday evening, the ER mainly treats emergencies, and the doctor added that the dermatology and plastic surgery departments have no one on duty, but the mother insisted they must call the plastic surgeons, asking if they didn't know how important beautiful legs are to a woman. The doctor thought to himself how her daughter was crying in pain, and that a parent's priority should be to alleviate her pain. Based on the color of the blood and the location of the injury, he deduced that the small saphenous vein was damaged. He suggested they should at least disinfect the wound for now. The mother agreed, but repeated that the suturing must be done by a plastic surgeon and that she would find another hospital if they couldn't provide one. The doctor began to disinfect the wound, then ligated the small saphenous vein. He asked the nurse to elevate the patient's leg slightly, while the journalist watched him work, noting that the wound seemed to have gone past the dermis and reached the muscle. Dr. Lee Min-ho explained to the patient's mother that the wound was very deep, the muscle was injured, and it seemed a major vein that carries blood from the calf to the heart had been severed. He explains they must perform a vascular anastomosis immediately and also need to repair the muscles, so he would contact the surgery department first. The mother interrupts him, suggesting he perform the vascular anastomosis himself and that she would call a plastic surgeon she knows to handle the skin. Indeed, the mother makes a phone call, while the doctor wonders to himself whether he should see this as love for her child or as her treating her like a possession. Meanwhile, the doctor was examining another patient when an angry man interrupted, asking when it would be his turn, claiming he had been there long before them. The doctor calmly explains that they don't see patients in order of arrival but prioritize cases by their severity and asks for his understanding. The doctor thinks to himself that this type of patient is a common sight he sees at least once a day. He asks his colleague, Dr. Woo In-hai, to take a look at the angry patient, then returns to finish examining his first patient. The patient tells him he was helping his wife cook when his chest suddenly started to hurt. The doctor asks if he is currently taking any medication, and the patient replies that he is on medication for high blood pressure and diabetes. The doctor deduces from this information, an elderly patient on blood pressure and diabetes medication with chest pain, that the problem could be with his heart or aorta. He asks how long the pain has lasted, and the patient says about an hour, and that he had felt tightness in his chest from time to time before, but today the pain started suddenly and severely. The doctor decides to start with a blood test and asks a nurse to accompany the patient to the blood collection room. After that, the doctor calls the fellow in the plastic surgery department, Lee Mi-ran, thinking to himself that all the plastic surgeons must have gone home by now. Mi-ran asks him over the phone if he has examined Mrs. An Ji-hyun's daughter, and denounces how he called her and told her the plastic surgeons couldn't come to the hospital, asking him why he lied. Mi-ran admits she didn't receive any call, and that the other professors are saying the same thing. The doctor replies that since it's the holidays, he thought calling them would be a nuisance, so he simply made it up. Mi-ran gets angry and tells him he's not the one to decide if it's a nuisance or not, reminding him he's just an intern. The doctor coldly asks her what she wanted him to do, then adds that from now on, whether it's day or night, if a patient looks for them, even if it's not serious, he will make sure to call every single doctor in the plastic surgery department. The doctor abruptly ends the call because he's busy, leaving Mi-ran in a state of shock. The doctor gets a bad feeling that he's about to get involved in something troublesome. While performing an ECG on the patient with chest pain, the doctor was thinking in confusion. He was sure there was something wrong with the heart or coronary artery, but the ST segment elevation and the increase in biomarkers were very slight. He knows that in such cases they must wait and repeat the tests, but he has a hunch that the patient's condition is deteriorating rapidly. He asks the nurse to prepare for a transesophageal echocardiogram. The chief resident Moon confronts Dr. Lee Min-ho, denouncing how he hung up on Dr. Lee Mi-ran from plastic surgery, who had called him angrily. The doctor thinks to himself how she ended up going to his superior to scold him. Moon asks him to talk outside, but the doctor apologizes, saying he is with a critical patient right now and asks to postpone the talk. Moon is surprised there's a critical patient, and the doctor explains he suspects the patient has acute coronary syndrome, even though the ECG and biomarkers showed no significant elevation. After hearing the doctor's suspicions based on the patient's age, medications, and signs, Moon immediately agrees and orders the examination to begin at once. During the transesophageal echocardiogram, the doctor discovers what he feared. One of the coronary arteries was severely swollen. He informs the chief resident, Moon Sung-ryong, that the syndrome has progressed to a myocardial infarction, and Moon Sung-ryong orders him to notify the cardiology department immediately. Moon feels relieved that he almost pulled a doctor away from a patient he was diligently treating, realizing it could have been a disaster. Meanwhile, Sung-ryong receives an angry call from Dr. Lee Mi-ran, who complains that Lee Min-ho hung up on her, and demands action be taken against him. Sung-ryong's anger grows after the call, wondering how Mi-ran dares to call him just because Min-ho didn't pamper one of her clients, while they are barely getting any sleep during the holidays. But he composes himself, realizing he shouldn't rush to judgment and blame an innocent person after hearing only one side of the story. After that, the days passed. The busy holiday ended, and calm returned to the ER. The doctors felt exhausted but were happy that things had been more bearable than they expected. Suddenly, the nurse receives a call for Dr. Lee Min-ho from Professor Kim Joo-hyuk of the cardiothoracic surgery department. Professor Kim asks the doctor why he isn't answering his phone. The doctor apologizes, explaining he had put his phone on silent mode and forgot about it, because in the end, the repeated calls from Mi-ran were hindering patient care. Professor Kim understands the situation, then reminds him of his previous wish to observe a thoracic surgery with video assistance. He asks if there's a surgery scheduled, and Professor Kim tells him they will be performing a lobectomy for a lung cancer patient in 20 minutes and invites him to attend if he can. The doctor thanks him enthusiastically and agrees immediately. As he is on his way, the journalist An Dong-hoon stops him, having heard he was going to observe a surgery, and asks if he can observe with him too. The journalist thinks to himself with admiration, how Minho, even after all this hard work, still loves to observe and learn about new surgeries, and that maybe with a doctor like him,